What should an expert neurological exam check for Parkinson's? Imagine trying to understand how well someone moves and controls their muscles. An expert neurological exam for Parkinson's disease focuses on specific signs that help doctors see if the disease might be present. The main features they look for are bradykinesia, rigidity, tremor, and gait or balance issues. These are the key clues that guide diagnosis because bradykinesia, or slowness of movement, is essential for identifying Parkinson's, and the others support that diagnosis. First, the doctor observes how quickly and smoothly the person can perform simple repetitive movements. They might ask the patient to tap their fingers rapidly, open and close their hands, or tap their toes. The doctor looks for a gradual slowing or reduction in the size of these movements, which can happen on one or both sides of the body. They also check how easily the person can start moving, as difficulty initiating movement is a hallmark of Parkinson's. Next, the doctor gently moves the patient's limbs, such as the shoulder, elbow, or wrist, to feel for rigidity. This increased muscle tone can feel like stiffness or resistance. Sometimes the doctor may notice a ratcheting sensation called cogwheel rigidity, which is like a series of small catches as the limb moves. To make subtle rigidity more noticeable, the doctor might perform an activation maneuver, like tapping the thigh, which can make the stiffness more apparent. The examiner then assesses for tremor, especially the rest tremor, which usually appears when the limb is relaxed and at rest. This tremor often occurs at a frequency of 4 to 6 cycles per second and typically starts on one side. The doctor might also observe for tremors during movement, known as kinetic or intentional tremors, to see if they are present in different situations. Gait and balance are also carefully checked. The person is asked to stand up from a chair, walk a short distance, and turn around. The doctor watches for shuffling steps, reduced arm swing, or difficulty starting to walk. A specific test called the pull test involves gently pulling the person backward to see how well they can maintain their balance and recover from a slight loss of stability. While balance problems tend to develop later, they are important for planning treatment and safety. Beyond these main signs, the doctor also looks for other clues. They observe spontaneous movements like facial expressions, eye blinking, and gestures, which often become reduced in Parkinson's. A quick mental check can help identify any cognitive or emotional changes. The doctor may test reflexes and sensation to rule out other neurological issues. Blood pressure measurements taken lying down and standing can reveal autonomic problems like postural hypotension, which is common in Parkinson's. Eye movement tests can also help differentiate Parkinson's from other similar conditions. It's important to remember that the neurological exam is just one part of the overall assessment. The doctor will also review the patient's medical history and may order imaging tests or lab work mainly to exclude other causes. But the clinical exam remains the cornerstone for diagnosis, monitoring disease progression, and guiding treatment choices. Every person with Parkinson's can experience symptoms differently, so the exam helps tailor care to each individual. Always consult a healthcare professional for a thorough, personalized evaluation and diagnosis.